Hi, my name is Amanda Thurman. I'm a doctorally prepared family nurse practitioner here at the Health Promotion Center and a proud Point Loma Nazarene alumni.
And I'm Kristen Kellogg. I am a family nurse practitioner and the clinic director at Health Promotion Center. And we're sharing with you a little bit about our fresh food marketplace. So that began with actually Amanda's doctoral project. And so she wanted to screen for food insecurity. And through her project, we learned that over half of our clinic patients are actively experiencing food insecurity. And so then my doctoral project sort of picked that up and said, okay, well, what are we going to do about it if this is impacting the majority of our patients here? And so we started a food box prescription program put together with education as well. And patients loved that program. It had really good health outcomes, actually increased healthy food eating behaviors, but patients wanted a little bit more flexibility and more autonomy in what they were having access to for food. And so that, in combination with the church pastor at the time, was trying to put together a new type of food program that would avoid lines. And so we looked at a few different models for addressing food insecurity and found the concept of a marketplace. And so it is patients can make appointments, or even community members can make appointments. They come at that time, they're able to shop completely for free. We try to stock it with really fresh fruits and vegetables. We get some whole grains. We try to have dairy products and protein available as well. And so it's just a really great opportunity to help address one of the biggest social determinants of health and one of the biggest barriers to patients being able to follow lifestyle recommendations that we give them here in the clinic. So our work with food insecurity has led to a lot of engagement and interaction with our patients and with clients in ways that we're understanding how their families and their health are all being impacted, as well as their mental health, sort of by being able to provide food as medicine. And so like last week, for example, we try really hard at the marketplace to focus on like fresh, healthy foods. Yes. And it always like kills us a little bit that there's these like really fancy desserts sometimes. But then we had a patient come in last week that saw the birthday cakes and got choked up and was teary-eyed and told us basically that she had no idea how she was going to get a birthday cake for her son that week. And so she was able to take the birthday cake from our marketplace and be able to celebrate her son's birthday. And just the way that impacted, sort of like she felt relieved and like this huge burden had sort of been taken off of them. And it was just like a really beautiful moment, basically.
Yeah. From a Christian perspective, personally, I did my doctoral study thinking, oh, I'll just do the study and it'll be done and that'll be it. But God has different ideas, because I did my study and identified food insecurity individuals here at the clinic. She did her study on the cardiometabolic effects. And lo and behold, behind the scenes, other churches were working on feeding people. Our pastor here at the time was working on feeding people. And through people we met that we did not expect to meet, we have developed this grocery store. By talking about it, we have received donors and other community partners, and it just keeps taking off. And so that is thrilling to see what God is doing, because this is all the Lord's work. It's really important to God to feed people. That's what we've come to notice. And so this has been a spiritual journey as well as a life's calling for us as well. So that's why we want to see this move forward and open more days of the grocery store and the fresh food marketplace at the clinic.
Since the beginning of the project with the food marketplace, we've seen God move and work and open doors and pathways that kind of have continued to spur on the work. And we're looking at opening more days over the next year and constantly looking for volunteer support and for people to get involved. And so if you're interested in participating in this work with us and helping us grow it, please contact us at the email provided.
Currently, we're open 1 day a week. Our goal is to expand to 2 days a week or more. But our patients desperately need healthy foods to live an active and healthy lifestyle. So we'd love for you to partner with us. Thank you.